I'll start. You guys can get started whenever you're ready.
Okay. Hello, everyone. Good morning. Today's presentation will be on gastroenterology. So in this presentation, we're going to go over what gastroenterology is, some gastrointestinal diseases, and some gastrointestinal procedures. At the very end, there will be a quick quiz on some of the information that we went over today. So gastroenterology is a subspecialty that focuses on studying, diagnosing, and treating disorders that are related to the digestive system or gastrointestinal tract. Your digestive system is super important because it breaks down the nutrients that enter your body so that your body can absorb it and use it for growth. The physicians that work in gastroenterology are called gastroenterologists. Next, we'll talk about gastrointestinal diseases.
We will now be moving on to gastrointestinal diseases, which are diseases that affect any section of the gastrointestinal tract. Let's start by talking about a gastrointestinal disease called irritable bowel syndrome. We'll start off with talking about irritable bowel syndrome. You may be wondering, what is this syndrome? Well, irritable bowel syndrome, also called IBS, is a disorder that affects the large intestine. It causes pain in the stomach, constipation, and diarrhea. There are multiple types of IBS. These types are IBS with diarrhea, known as IBS-D, IBS with constipation, known as IBS-C, mixed IBS, known as IBS-M, which involves both constipation and diarrhea, and unsubtyped IBS, which is a type of IBS where people don't fit into the types mentioned above. Symptoms of IBS include irregular bowel movements, a change in appearance of bowel movements, abdominal pain that comes with passing of bowel movements, bloating, diarrhea, constipation, food intolerance, tiredness, and headaches. There isn't really a known cause for the symptoms of IBS or IBS itself. Some factors that may contribute to the development of IBS include strong and long-lasting muscle contractions in the intestine, abnormalities in the nerves of the digestive system, severe infections that could have been developed through past episodes of having diarrhea that were caused by a bacteria or virus, and any changes in gut microbes, such as changes in bacteria or fungi. Some risk factors for developing IBS include being young, as people under 50 are more likely to get IBS, being female, having mental health disorders such as anxiety or depression, and having a family history of IBS. Treatment may vary depending on what your doctor recommends, but usually treatment involves managing and maintaining a healthy diet and exercising, as well as some medications such as tenapanor, probiotics, and laxatives. That was all for IBS. I hope you learned something new. We will now move on to another type of gastrointestinal disease called malabsorption.
So malabsorption is when someone's body can't get the nutrients that they need from the food that they eat. And so even if they're eating carrots, the body isn't able to digest it properly. And so it doesn't get what it needs from the carrots. So this happens because it has to do with issues in the digestive system. And sometimes there aren't enough digestive enzymes in the body which help break down the food. Another reason for this is a virus or bacteria in the body. And some symptoms for this would include bloating, diarrhea, fatigue, gas, stomach pain, and iron deficiencies, which could lead to anemia and weight loss. Doctors test for this using a lot of tests because this is a really broad subject. So this could include blood tests where they check for nutrients, stool tests where they look for fat in the stool, sweat tests where they can look at your enzymes, and also biopsies and endoscopies where they look at the body and sample material from your body, such as tissue. The course of treatment is extremely broad and it's really dependent on the patient and what the doctor says. But usually this includes some sort of special diet and supplements to make sure that they're getting the right nutrients. And now we'll be moving on to peptic ulcers.
So peptic ulcers are open sores are open sores inside the lining of the stomach, which are called gastric ulcers, and the upper portion of the small intestine, which are called duodenal ulcers. The most common symptom for peptic ulcers is stomach pain, but other symptoms include fullness, bloating, blushing, intolerance to fatty food, nausea, and heartburn. Most people with peptic ulcers don't know they have them, but some other serious signs, which are less common, include vomiting/vomiting blood, dark blood in stools, trouble breathing, feeling faint, unexplained weight loss, and appetite loss. The cause of peptic ulcers, there are a few. One is a bacterium, and it's unclear how this bacteria is transmitted, but it can be from person to person or through food and water. Another cause is also the regular use of painkillers such as ibuprofen, and some well-known brands of that is Advil and Motrin, and also other medications like steroids and anticoagulants. So to prevent yourself from getting this, you have to protect yourself from infections and use pain relievers with caution. Some risk factors include smoking, alcohol, and untreated stress. And complications include internal bleeding, perforation, which is a hole in the walls of the stomach or small intestine, obstruction, which is the blockage of the food through the digestive tract, and even gastric cancer. So, how are these ulcers treated? It depends on the cause, but it starts with eliminating the bacterium and reducing the medications. Antibiotics are given to eliminate the bacterium, and medications are given to block acid production and promote healing. Medications are also prescribed to protect the lining of the stomach and the small intestine. Next, we will move on to colon polyps/colon cancer.
We'll now go over colon polyps and colon cancers. Colon polyps are a small clump of cells that form along the lining of your colon. Most polyps start as benign, which means they aren't cancerous. However, some polyps can develop into colon cancer. Your colon is also known as the large intestine, which absorbs water and salts from the material that has not yet been digested as food. Polyps are caused by mutations in your colon, which is like how tumors form. There are two types of polyps, non-neoplastic and neoplastic. Neoplastic polyps are more likely to cause colon cancer than non-neoplastic polyps. In addition, larger polyps are more likely to cause colon cancer. Symptoms of colon polyps include rectal and anal bleeding, changes in feces color, and changes in bowel habits. However, some of these symptoms can be caused by other conditions. So in order to definitively diagnose someone with colon polyps, they are they'll either need a colonoscopy or a CT colonography. If any polyps are found, they are usually removed with forceps, but if they are too large, they are removed by inserting an instrument called a laparoscope into the bowel. Symptoms of colon cancer are similar to symptoms of colon polyps. Like other cancers, colon cancer occurs when cells uncontrollably divide. To diagnose colon cancer, a colonoscopy is used to find any polyps and tissue samples, which are taken to determine whether a polyp is benign or malignant. If a polyp is malignant, subsequent CT tests may be recommended to determine how much the cancer has metastasized. In colon cancer that is still local, treatment is similar to the treatment of colon polyps. However, in colon cancer that has spread, treatment may include a partial colectomy, which removes part of the colon with cancer, or an ostomy, which opens the wall of the colon with cancer to turn into stool. We'll now move on to diverticular disease.
Now let's learn about diverticular disease, which occurs in your large intestine, or also called your colon. Diverticular disease, also known as diverticulosis, is when small bulging pouches occur that develop in the digestive tract that become inflamed or infected, known as diverticulitis. If the diverticula become infected or inflamed, there could be a result of fever and abdominal pain. Some people also experience constipation and more gastrointestinal pain. Some causes include high pressure within the colon, or a diet in low fiber or high in red meat. Therefore, as a treatment, medical professionals advise to limit red meat and eat a diet high in fiber, fruits, and vegetables. Other forms of treatment include antibiotics in the pill form, or PO, or intravenously, or IV. Serious treatment like surgery is usually not needed unless there is inflammation, which again is known as diverticulitis. This condition is common in people over the age of 40, and although treatment can help, this condition unfortunately cannot be cured. You are also more at risk if you are male, eat a low-fiber diet, smoke, don't exercise, and are overweight. Now let's learn about gastrointestinal procedures.
Hello everyone, so now we'll be moving on to gastrointestinal procedures. These procedures help us diagnose some of the gastrointestinal diseases we've mentioned before. Let's go on to the first one, an enteroscopy. An enteroscopy is a procedure where an endoscope is inserted in your digestive tract. It's an umbrella term because there are many forms of enteroscopy, which you may hear later on. The purpose of performing an enteroscopy is to examine the digestive system and possibly diagnose diseases we've mentioned before. Also, you can divide the types of enteroscopy into two types. One of them is an upper enteroscopy, where the endoscope is inserted into the mouth and it will be used to observe your throat to the upper portion of the small intestine. And you can see that procedure in the image to the right. The other type is a lower enteroscopy, where the endoscope is inserted into the rectum and it will be used to observe your lower digestive tract. Now that we've settled what an enteroscopy is, we can explore how doctors perform one. First, we have the preparation stage. To prepare for an enteroscopy, doctors may recommend different things depending on your type of enteroscopy. For instance, you might be advised to stop taking blood thinning medications, fast, avoid liquids, or take a laxative for a colonoscopy. During the procedure, it's relatively short and simple. An enteroscopy is usually 45 minutes to 2 hours long, and don't worry, you'll be given sedatives or medicines to help you relax. The doctor will take pictures or videos of your digestive tract to examine later on. If necessary, they may even take samples to examine for any disease or remove any tumors. After the procedure, there may be some risks associated with getting an enteroscopy. For instance, you might have a sore throat, some abdominal bleeding, nausea, or cramps. But obviously, if you ever feel uncomfortable after your procedure, let a doctor know so they can treat any risk or reassure that you're fine. Lastly comes the results. Depending on what the doctor found, you may find that you have a disease, tumor, internal bleeding, or abnormal tissue. If so, your doctor will definitely look after your symptoms and plan a treatment that helps you. Now let's move on to a colonoscopy.
A colonoscopy is an exam used to detect changes or abnormalities in the colon and rectum. Doctors recommend colonoscopies for many reasons. Some of them are to investigate intestinal signs or symptoms, screen for colon cancer, or look for polyps. Colon polyps are small clumps of cells that form on the lining of the colon. Colon polyps are usually benign, but some can develop into colon cancer. Some of the risks of colonoscopies are an adverse reaction to the sedative used, bleeding from the site where the surgery was performed, or perforation. With a colonoscopy, doctors can see inside the colon and rectum. They will use a flexible, hollow, lighted tube about the thickness of a pen called a colonoscope. It has a tiny video camera on the end. The doctor will be looking for polyps or any abnormalities. If they find any, they can remove them while they're doing the exam. This is why it's important for a patient to have a clean colon before the exam so the doctor can get a clear look of what's going on inside. Patients usually have to follow a special diet, take laxatives, and adjust their medications the day before their exam. The exam takes around 30 to 60 minutes. We will now be moving on to capsule endoscopy.
Now we'll talk about a capsule endoscopy. A capsule endoscopy is a procedure where the patient swallows a capsule the size of a vitamin pill, which contains a wireless camera. As the capsule and camera goes through the digestive tract, it takes many pictures which are transmitted to a recorder kept on a belt on the patient's waist. Once the procedure is complete, a specialist can interpret the photos that were saved to the recording device. The purpose of a capsule endoscopy is to help make a diagnosis by seeing what might be going on inside the small intestine. Some specific purposes of a capsule endoscopy are to find the cause of gastrointestinal bleeding, screen a patient for abnormal tissue growth, or diagnose something such as celiac disease or gastrointestinal cancer. The preparation of a capsule endoscopy includes not eating or drinking for at least 12 hours before the procedure. Sometimes a doctor will ask their patient to take a laxative prior to their procedure in order to flush out the small intestine. Also, adhesive sensors are placed on the abdomen and the recording device is attached to the waist on a belt before the procedure. During the procedure, there must not be strenuous physical activity being done, and the equipment needs to stay dry. The procedure generally lasts about 8 hours, but everything is essentially happening inside of you. Once the procedure is over, the recorder and sensors will be removed. The capsule will be passed naturally and can be flushed in the toilet. You can eat 4 hours after swallowing the capsule, and you can drink after 2 hours. Lastly, some potential risks of a capsule endoscopy is that the capsule becomes lodged in the digestive tract, in which case a bowel obstruction has occurred. Other than that, the procedure is pretty safe. Next, we'll move on to a sigmoidoscopy.
Now we're going to talk about a sigmoidoscopy, a procedure which is very similar to colonoscopy, which scans your colon for cancer and other diseases that may pop up in your colon using a camera on the end of a cable. But it has one stark difference, which is the distance that the colonoscope is put into your colon. Sigmoidoscopes only go to your lower colon, which is also known as your sigmoid colon. This is right until it starts to change direction at that top kind of highest part of your colon. The procedure is the exact same otherwise. Before the procedure, you must be on a liquid diet, which includes broth, strained juice, which basically no pulp in your juice, black coffee, and other liquids. You may need to take a laxative to flush your system out. During the actual procedure itself, which is pretty much entirely painless, a camera goes into your colon, entering from your rectum, and a tool can be fed through the cable, which is attached to the camera, to grab colon polyps that are hanging off of your colon. The doctor or physician may give you medication to help you relax during this 15 to 20 minute process, as it can be very uncomfortable. After the procedure, activities can be immediately resumed, as there isn't really any, unless you have side effects, which these side effects might be feeling bloated as they put air into your body to open up space for the colonoscope, dizziness, weakness, a fever of 100, abdominal pain, and small amounts of bleeding. There are some rare risks, such as prolonged bleeding, inflammation in the lining of your belly, and one which is very rare, a hole in your intestinal wall. That's it for a sigmoidoscopy. Next, we will be talking about a pancreas scan.
A pancreas scan is a scan done to screen for any primary or metastatic cancer of the pancreas. This type of scan is a nuclear radiology test, which means that there is a tiny amount of radioactive substance which is used to help radiologists check the pancreas. A little bit of context on the pancreas. The pancreas is a long, narrow organ which is located across the back of the belly or the abdomen and behind our stomachs. Preparation for the pancreas scan. Diabetics should eat a light breakfast or lunch 3 hours prior to the scan time. You should try to refrain from eating anything 3 hours prior to your scan to help reduce the side effects. If you have any issues concerning the kidney, inform the hospital before making your appointment. If you have any allergic reactions to contrast media, remember to inform the hospital so you can get a scan without one. And please remember to hydrate yourself. Also, a little context on contrast media. They are materials used to improve pictures of the inside of the body. During the pancreas scan, the scan will take anywhere around 25 to 45 minutes. Sometimes an IV line may be attached to your hand or arm if you're using a contrast media. You will feel nauseous with a headache and feel a flushing sensation with a salty or metallic taste in your mouth. After the scan, if contrast media is used, you'll be kept for monitoring after the scan to check for any side effects. If you notice any redness, rashes, or swelling, please contact your doctor immediately. Risks. If contrast media is used, there is a risk for allergic reaction to the media, even if you didn't know you had an allergy to it. In some cases, the contrast media can cause kidney failure, especially if the person is dehydrated or has an underlying kidney problem. Next is the liver biopsy.
So before we get into the liver biopsy, the liver is an important organ that helps the body digest foods. It also removes contaminants from the blood, fights infections, and stores important nutrients. So in a liver biopsy, a small portion of liver tissue is surgically removed to be analyzed in a lab. And the purpose of a liver biopsy is to evaluate diseases and detect infection, inflammation, or cancer. Liver biopsies are usually needed when patients feel abdominal pain, have problems with the digestive system, or experience symptoms that suggest liver damage. Before the procedure, you'll undergo a physical exam and also a blood test. You should provide your complete medical history to your doctor. You should also stop taking medications that can affect bleeding. You shouldn't drink or eat for up to 8 hours before the procedure, and also arrange for someone to drive you home because you might not be able to move or drive after the procedure. During the procedure, you'll receive sedative through an IV line to help you relax. There are 3 types of biopsies. The first one is a needle biopsy, where a thin needle is put through the abdomen and into the liver. A transjugular biopsy is when the surgeon makes a small incision at the neck and then inserts a flexible tube into the jugular vein and the liver. This method is used for people who have bleeding disorders. So for people who don't have bleeding disorders, another method is usually used. And the third one is a laparoscopic biopsy. And this is when a tube-like instrument collects a sample through a really small incision in the abdomen. And then after they take out the sample from your liver, the incision wounds will be closed with stitches and bandages, and you'll lie in bed for a few hours after the procedure while doctors monitor you. And then after the procedure, you can resume your normal activities after a few days, and then you'll get your results back, and if applicable, you'll get a diagnosis, and then your doctor will also discuss treatment plans with you. And some risks are rare cases of infection and bleeding, and in severe cases of bleeding, blood transfusions or surgery may be needed to stop the bleeding. Now we'll be moving on to the quiz, and then I think Kelly and Marcel will lead this.
So for this first question, I'm going to give a quick description of one of the gastrointestinal diseases that we covered today, and you guys can tell me which gastrointestinal disease you think it matches up with. So the description is difficulty taking in nutrients from the food you eat. You guys can type it in the chat if you remember which one you think it is.
Yeah, maybe we can like go back through the slides and then see if people know which one it is. I think someone guessed malabsorption. Does everyone else agree, or should we go back to the slide maybe to check? No, Zachary, why do you want to say yeet again? Okay, I think Kyle got it right.
Yeah, so the correct gastrointestinal disease is malabsorption. And the second question is a true or false statement. The statement is a colonoscopy is used to examine the small intestine. Is this true or is this false? Yeah, so this is actually false because a colonoscopy is used to find changes or abnormalities in the large intestine, not the small intestine.
The next part of the quiz will be covering 2 scans. So the first question is what does a sigmoidoscopy scan? If you need a hint, It's in the name.
Okay, I think we have a guess from Sora. Since it's the colon, I think that's really close. Does anyone else have a guess?
You're
I
on
think
the right
Marcel
track.
gave a clue. Yeah. Marcel gave a clue that it's in the word, so it's in Sigmoidoscopy. I think we just give the answer.
The answer is the sigmoid colon, the lower area of your colon.
Yeah, so I think colon is like, it's really close. It's just a part of it. Yeah.
Next question will be, what does a capsule endoscopy scan? This one's a little more difficult. The answer is the small intestine, the very longest part of your digestive system.
Yeah, that was a difficult question.
This is our social media. Follow using Pre Med on Instagram, and here's our website. Thank you for attending today's session. Does anyone have any questions?
Yeah, you guys can feel free to put in questions in the chat. I think on the slide it also says the next session. It's on July 25th. So after this session, we'll be having 3 speakers coming, and then after that, we'll be having a presentation on mutations. So the speaker who's coming next week, I think Ashley, you invited her. You can feel free to add anything, but she's a licensed psychologist from Texas, and so she graduated from Fordham University, and then she also focuses on like South Asian Americans. So she's like a chair of a division and also an editor of the first book focused on South Asian American psychology. She has a lot of experience with clinical research, and she's also specialized in working with people who deal with depression, anxiety, relational issues, adjustment disorders, grief, medical issues, trauma, self-esteem problems, racial identity, and multicultural issues. Oh, no, the session is on July 5th. I think we had a typo. Yeah, it's on the 25th. Then, yeah, Ashley, did you want to add on to that? I just read the description you sent me.
Not really, you pretty much covered everything. But yeah, so she's a division chair of the South Asian American like psychology department, and she's also the editor of the first ever book written about South Asian Americans about mental health. And yeah, that's pretty much it.
Yeah, so that's something really exciting to look forward to. And then after that session, we have another speaker on August 1st, and then I think Liz invited the speaker. It's going to be Dr. Smith, who's a pediatric dentist and a diplomat of the American Board of Pediatric Dentistry. And her main goal as a pediatric dentist is to help children and their families establish a foundation for excellent dental health through each stage of growth and development. She graduated from Stanford University with a degree in human biology and pursued her dental education at UCLA School of Dentistry, so both of which are really prestigious schools. She has her own local practice, Burlingame Practice Dentistry, in addition to pediatric dentistry in San Francisco. So we've never had a dentist come speak to us, so this is something definitely really exciting to look forward to. And Liz, did you want to add anything?
No, that sounds about right.
All right, sounds good. And then on August 8th, we'll be having Nurse Klein invited by Kathleen. She's a full-time certified pediatric intensive care nurse at a level 1 trauma and educational healthcare center. She's passionate about helping people aspiring and current pediatric nurses connect, learn, and grow into a better version of themselves personally and clinically. So definitely a really good opportunity to build connections at these speaker sessions. And then, like I mentioned before, at our final session, we'll be talking about mutations and how those lead to like different diseases. Yeah, does anyone have any questions on that? I think if you do have questions, you can put them in the chat. But if Kelly and Marcel don't have anything else to add, I think I'm okay with ending the session a little bit early. I started the session a little bit early, so I think we have like 5-ish minutes left, maybe less. So we'll see you guys next week at the speaker session, but that's all we have for today. Thank you.